All right, what's up, guys, and welcome to Diabetes Talk. I'm your host, Charlie O'Connell, and today's topic is your diabetes medication causing low blood sugar for you? And this is one of the most important topics that we have covered. Guys, we are going to be really breaking down the different side effects of medications for diabetes, help you understand what diabetes medications have a risk or side effect of hypoglycemia, which is low blood sugar, and then giving you some very, very practical advice for how to deal with that if that's something that's happening to you. Okay, so to start off with, okay, diabetes is a disease of elevated blood sugar levels, and it's very, very important to just put that out in front. Diabetes is a disease of elevated blood sugar levels. The reason why elevated blood sugar levels are bad for you is molecules of blood sugar, if they are circulating around your body at elevated levels, they can start to damage your red blood cells and the inside lining of your blood vessels. And if they continue to circulate, continue to scrape, continue to deposit, okay, into things like your hemoglobin cells, which are your red blood cells, or they start to scrape against the inside of your blood vessels, that is what the actual cause of complications from diabetes is. So very important, just to start, guys, diabetes is a disease of elevated blood sugar. Now, diabetes medications ultimately are solutions for you to help you manage your diabetes with the ultimate goal of getting your blood sugar levels into a healthy range. And a healthy range is an A1C of below 7, okay, so let's start with that. And or if you're using a glucose meter, especially here in the United States, a range of 80 to 154. That is basically where you are trying to get your diabetes. And once you get, the reason why we say 154 is equal to an A1C of 7.0. As long as you are able to keep your A1C at 7.0 or keep your blood glucose levels at 154 or below, you dramatically reduce your risks for complications associated with diabetes. Now, having said that, different diabetes medications do different things to help you manage your blood sugars. And that's what we're going to break down right now. And we're going to start off with the two classes or types of medications that can cause hypoglycemia. And hypoglycemia is low blood sugar. So, the two types of medications that have a known on the warning label of the medication side effect of low blood sugar are insulin and a class of drugs called sulfonylureas. Okay? Now, both of those are related to a defect, and there's a very, very important concept and information that you need to become aware of, and it's something called the ominous octet. And what the ominous octet is a phrase that was coined by a guy named Dr. Ralph DeFronzo. I said Dr. DeFronzo's name wrong the last time we talked about this, so I want to be very, very clear. Dr. Ralph DeFronzo coined this phrase, the ominous octet. And basically what the ominous octet is referencing is the 8 different defects that can cause high blood sugar levels. Okay? So the first defect is an inability to produce enough insulin to lower blood sugar levels. So let's understand what insulin is. Insulin is a hormone that's produced by your pancreas, and what insulin does is it causes the absorption of glucose into your liver, muscle, and fat tissue. That is what insulin does as relates to high blood sugar. Okay? So the defect that insulin addresses is the pancreas's inability to produce enough insulin or any insulin. Now, if you have type 1 diabetes, your pancreas is not producing any insulin. And so you have to take exogenous insulin. And exogenous insulin is insulin that you inject, and the names of those insulins are things like Humalog or Novolog or Levemir or Toujeo or Tresiba or Apidra or Humalin, okay? And I would encourage you to use Google to find out what different types of insulins do, okay? But the bottom line is all insulins are designed to lower blood sugar levels, and they all have a side effect of risk for low blood sugar. And in some cases, that risk of low blood sugar can come to be a very, very frequent problem, especially if you have type 1 diabetes and especially if you are taking fast-acting insulin. So there's two different types of insulin. There's fast-acting insulin and long-acting insulin. Fast-acting insulin is insulin like Humalog or Novolog or Apidra or Afrezza. Long-acting insulin are things like Levemir or Tresiba or Lantus. If you are taking rapid-acting, short-acting insulin like Humalog or Novolog, you may be at risk for hypoglycemia, and that is something you need to work with your healthcare provider about if you are experiencing that frequently. And if you are experiencing it frequently during exercise, I want you to check out one of the videos that we've created called Follow Your Heart, where I really break down the relationship between heart rate levels, glucose levels, and the counter-regulatory hormones that are required for a type 1 diabetic to achieve steady glucose levels. All right. Now, so that's type 1, and that's insulin with type 1. Now let's talk about type 2. When a person living with type 2 has a defect related to their pancreas not producing enough insulin, they are put on either a sulfonylurea or exogenous insulin, or sometimes both. So what is a sulfonylurea? A sulfonylurea is an oral medication that causes the pancreas to secrete more insulin. It actually stimulates your pancreas to secrete more insulin. And the names of those sulfonylureas are drugs like glipizide, glyburide, glimepiride, okay, and the meglitinides, which are Prandin and Starlix. If you are on a sulfonylurea, you are definitely at risk for the medication itself causing low blood sugar episodes. And if you are on a long-acting insulin, so for example, Lantus is the most prescribed insulin for type 2 diabetes. There are millions of people taking Lantus. And if you are taking Lantus, you are definitely at risk for low blood sugar episodes. If you start to exercise, if you join us in the GlucoseZone, you are probably going to have to start reducing the amount of insulin and the amount of sulfonylureas that you are taking. And here is the reason why. Exercise fundamentally changes your sensitivity to insulin and your requirement for insulin. And this is why, guys, GlucoseZone is such a fundamental therapeutic option for so many people living with diabetes. And we see this over and over and over again. We see people who start doing GlucoseZone programming immediately having to reduce the amount of sulfonylureas they're taking, having to reduce the amount of insulin they're taking. And we have seen at this point, we have seen dozens and dozens of people completely come off of insulin that they were taking, and significant amounts of insulin. We had one person who had type 2 diabetes. She was actually all the way onto an insulin pump. That's how far this defect had gone for her, where her pancreas wasn't producing enough insulin. She started GlucoseZone. I swear to God, 90 days later, she was completely taken off of the insulin pump. And, I was talking to a doctor about that, and the doctor said, Charlie, that's like headline news on USA Today. People do not come off of insulin pumps once they are put on it. But the truth is, guys, it's totally possible. And it really is through exercise, because exercise fundamentally changes your body's sensitivity to insulin and your body's requirement for insulin. All right? So if you're starting to, if you started GlucoseZone, if you are starting to notice low blood sugar episodes and you're on a sulfonylurea or on insulin, you need to contact your healthcare provider immediately, explain to them what's happening, and probably what your healthcare provider is going to do is start reducing the amount of sulfonylureas you're taking, reducing the amount of insulin that you're taking. All right? And ultimately, I know that that's a goal for a lot of our GlucoseZone members, as it should be. All right? But I want to caution you, if that's a goal for you, you need to do that in coordination with your healthcare provider. Okay? And if you don't have a healthcare provider, I want you to reach out to us, and we're going to help connect you with a healthcare provider. All right. The ominous octet. So a defect in the pancreas not producing enough insulin is just one potential cause. Okay? Now, the two medications, sulfonylureas and insulin, those are the medications that most likely will cause low blood sugar episodes. And there are millions of people taking those medications. What I want to do now is actually break down the other defects in the ominous octet, help you understand what are the medications associated with those defects, and then talk about some of the side effects. So the next defect is called impaired neurotransmitter signaling function. And that is a mouthful, guys. And basically, the drug that addresses impaired neurotransmitter signaling function are GLPs. So what the term neurotransmitter signal function means is some people, the cause of their hyperglycemia is high blood sugar. The cause of their high blood sugar is that the neurotransmitters between their brain and their stomach are not working properly, okay? And the signaling process that is supposed to happen through your entire metabolism and your entire endocrine system, that is supposed to transmit signals from your brain and your stomach that food is present, release insulin, okay? That actual transmission of information can be defected. And GLP-1s address that defect. So GLP-1s by brand name are Bydureon, Victoza, Tanzium, and Trulicity. Okay? If you are taking one of those medications, that is what the actual defect that's addressed by that medication. Okay? Another one is called amylin, and then the last one is cycloset. So all of those medications I just mentioned are in the GLP-1 class, and what they address are an impaired neurotransmitter signaling function. And what that means is that basically your brain and your stomach are not getting the message that either food is present or that you're full. All right. The next defect is something called increased hepatic glucose secretion, okay? And what increased hepatic glucose secretion means is your liver is secreting too much glucose. So remember how we talked about what is insulin? Insulin is a hormone that causes the absorption of glucose. One of the places that it causes the absorption of glucose is into your liver. And when glucose is stored in your liver, it's converted into something called glycogen. Now, some people, the defect that's leading to their high blood sugar is an increased release of that glycogen from their liver into the bloodstream, and that raises blood glucose levels, okay? And the medication that addresses that is metformin. Now, metformin is the most popular, the most prescribed diabetes medication. And if you go to the actual guidelines for pharmacological management of type 2 diabetes, it's very, very clear that metformin is universally recognized as the monotherapy. So the first therapy that every single person living with diabetes that basically requires a pharmacological solution, they're put on metformin. And what metformin does is it decreases the release of glucose from the liver. So metformin does not actually lower your blood sugar levels. And this is very, very important to understand. Metformin does not lower your blood sugar levels. Metformin suppresses or inhibits the release of glucose from your liver into your bloodstream. Okay? Now, the next defect is something called increased glucagon secretion regardless of blood sugar levels. Now, glucagon is a very important term that you need to be aware of. And one of the things that's hard about diabetes management is many of the terms sound very similar. So there's glucagon and there's glycogen. There's glucose and there's glycogenolysis. All of these terms mean very, very different things. So glucagon is an important term that you must understand. Your pancreas secretes two hormones. In the beta cells, it secretes insulin. In the alpha cells, it secretes glucagon. And those two hormones work very, very sympathetically with each other. So in a healthy, functioning, endocrine, non-diabetic system, your pancreas is constantly releasing either insulin or glucagon, insulin or glucagon. What insulin does is insulin lowers blood sugar levels. What glucagon does is it raises blood sugar levels. And the way that glucagon raises blood sugar levels is by signaling your liver to release stored glycogen, and by signaling your adipocyte tissue, which is your fat tissue, to convert triglycerides back into glucose. Okay? And it's very, very important that you understand what glucagon is. Now, one of the defects related to glucagon is an increased glucagon secretion regardless of blood sugar. So what that means is, let's say that you have a blood sugar of 200. Well, if you have this particular defect, your body will be secreting the hormone glucagon, even though your blood sugar is already raised. If your blood sugar is 200, you do not need more glucagon, right? You need the opposite. You need insulin. If your blood sugar is 80, you don't need insulin. You need glucagon. Okay? What this defect, the medications that address this defect, is also GLP-1s. And this is very interesting. So GLPs are a very new diabetes medication, and they are designed to impact multiple parts of the ominous octet. So what a GLP-1 does in this particular defect is it decreases the body's breakdown of glycogen into glucose. It stops the signaling of glucagon from happening. And again, GLP-1s are things like Bydureon, Victoza, Trulicity, and those other drugs that I mentioned earlier. Now, there's another class of drugs that achieves the same thing, and they're called DPP-4s, okay? And DPP-4s are very, very commonly prescribed medications. But the names of DPP-4s are drug names like Onglyza, Januvia, Tradjenta. These are a class of medication that specifically decrease the amount of glucagon your body is secreting. All right, the next defect. Now this is a hard one, okay? This is a very challenging one. It's hard to explain and it's hard to understand. So the next defect is something called a decreased incretin effect. Okay? Incretins signal your brain that you have eaten, allow the uptake of glucose into cells, and stop the breakdown of glucose by the liver, and signal the pancreas to release insulin. So what incretins are, okay, are like, this is an easy, fun way to understand this. Incretins are like Paul Revere. Okay, you know the story about Paul Revere, where he jumped on his horse and he rang a bell and he said, "The redcoats are coming, the redcoats are coming." Okay? Well, incretins are the actual signals that say, glucose is coming, glucose is coming. Release some insulin. Okay? Stop breaking down fat, stop releasing sugar from the liver, tell insulin, you're up. It's time for insulin to start releasing so that blood sugars can come down. And it all has to do with your stomach, right? You eat food, that food gets digested, the body recognizes that there's sources of glucose coming, incretins are then released. They're the Paul Revere of the endocrine system. And they are signaling, there are signals in the body to tell you basically to release insulin. Now, the actual medications, okay, that mimic incretins and they increase satiety, increase satiety, these are mouthfuls, guys. Even for me, some of these explanations are really, really challenging. Increase satiety. So what that means is you basically feel hungry, you feel fuller faster, and they decrease glycogen breakdown, okay? Decrease glycogen breakdown when food is present. It's the GLPs and the DPP4s. So the reason why doctors and pharmaceutical companies and insurance companies like GLPs and DPP4s is because they're single medications that address multiple defects, and they all address the glucagon aspect of managing diabetes. All right. The next defect is something called increased fat breakdown and decreased glucose uptake into the fat cells. So what that means, that sounds like, this is a confusing thing because that sounds like something that you would want, right? You would want increased fat breakdown. Well, sometimes increased fat breakdown can be a problem if you cannot store glucose properly in your fat cells. And that is actually something that happens to people with type 1.5 diabetes. So this would be an example of, you may know somebody living with diabetes that does not have the typical symptoms of diabetes. They're not overweight, they're not obese, they don't eat too much. In fact, they're the opposite. They're skinny, okay? But yet they have diabetes. So this defect is actually usually associated with that type of person. And what the answer is from a pharmacological perspective is to enable the body to create more fat cells. And those are created by a class of drugs called TZDs, okay? And the brand names for TZDs are Actos and Avandia, okay? And the generic names of those are pioglitazone and rosiglitazone. So Actos and Avandia, what they actually do is they actually cause you to build more fat cells. They enable your body to build more fat cells to address this defect of breaking down too much fat, even though your blood sugar levels are high, okay, and your inability to store glucose in your fat cells. Now, I'm going to kind of state something that's fairly obvious, but if you are overweight or weight loss is a goal for you and you are taking a drug like Actos or Avandia and you start GlucoseZone for sure, you should talk to your doctor about reducing that medication, or maybe even is that medication appropriate for you. All right. The next defect is decreased glucose uptake by the muscles. And this is where GlucoseZone, guys, is the answer, is the therapeutic answer. If you have an issue of decreased glucose uptake in the muscles, GlucoseZone will fundamentally help change that situation. And from a pharmacological perspective, the medications that do that are insulin and TZDs, which was the medication I just talked about, okay? And sometimes metformin. But the reality is, guys, is exercise is the medicine here. And this is actually every single person living with diabetes, every single person at risk for diabetes is told by their doctor, you need to start exercise, because your doctor knows that the most likely cause of your elevated blood sugar, especially when you are at risk for diabetes, is this defect of decreased glucose uptake by the muscles. And it's a very, very simple reason why that is, guys. After the age of 25, our bodies naturally start to lose muscle mass if we don't exercise consistently. And the loss of that muscle mass can occur at up to 2% loss per year. Now, your muscles are the primary places in your body where glucose is supposed to be stored. Let's say that you're 40 years old, okay, and you haven't exercised since you were 25. So that's 15 years of inactivity. That means that you could have potentially lost 30% of your ability to store glucose in your muscles. You have decreased the uptake of glucose into your muscles by 30%. And what that leads to is being at risk for diabetes or developing full-blown diabetes. As soon as you start exercising and you increase the storage tank in your muscles, usually what happens is an immediate normalizing of glucose levels, okay, and the ability to reduce medication. So using GlucoseZone, guys, as your therapy is not just, it's not just because we're fitness geeks here. It is universally recognized that exercise is a fundamental preferred therapy for the reduction of hyperglycemia. And this is really the other important point, you can use GlucoseZone to determine if you are on the right medication. How and why do I mean that? Well, let's say that you are doing GlucoseZone, okay, and you're not seeing a change in your glucose levels. That will fundamentally tell you that the defect that's causing your hyperglycemia is not related to your muscle intake of glucose. That will fundamentally tell you it is not related to your body's ability to store glucose in your liver. Okay? That'll fundamentally tell you this is not related to your body's ability to store glucose in your fat cells. So GlucoseZone is actually an amazing tool, not only for reducing and reversing and taking control of your diabetes, but actually for identifying, are you on the right medication? All right, now, the last defect, okay, is something called increased glucose reabsorption. And what increased glucose reabsorption means is your body, specifically your kidneys, are absorbing too much glucose, okay, and the drug that addresses that defect is a class of drugs called SGLT2s. And SGLT2s, the brand names are Invokana and Farxiga. And what Invokana and Farxiga do is they allow glucose that's circulating through the digestion process to be diverted out through your urine, all right, and to be removed by the body in that way. That is what SGLT2s, that is what they do. They divert excess glucose through the urinary system, okay, and that's how they actually bring glucose levels down. All right. Those guys are the 8 defects associated with hyperglycemia. Those are the medication classes associated with each defect. Now, when speaking with your healthcare provider, you should ask about the side effects that are associated with these different medications, especially if you are experiencing low blood sugar. If you start GlucoseZone and you start to notice your blood sugar levels are coming down, or you're even going hypoglycemia, or you're going hypoglycemic, you should immediately talk to your doctor about reducing your medications, because that's fundamentally telling you you do not have the need for prophylactic solutions, pharmacological solutions, to lower and bring your blood sugar levels in range. Okay? The other thing is, guys, there is now a whole new class of drugs which are called combination drugs. And basically what they do is they combine 2 different drugs. So probably the most common one is the combination of Metformin and sulfonylureas. So those drugs are called Metaglib, for example, or Evanderol, or Glucovance, okay, or Duatact. These are medications that take 2 different medications and combine them in one pill. Okay? You need to talk with your doctor about these medications. Now, if you are taking a sulfonylurea, if you are taking insulin, or if you experience low blood sugar for any other reason, you definitely should be keeping carbohydrate and fast-acting sugar available with you. That's part of safe exercise with diabetes. That's part of just basically managing your life. All right? Now, the last thing, guys, is medications for diabetes are necessary. So do not make the fatal mistake of thinking, I don't need to take medications, okay? Don't do that. What I want you to do is systematically identify what is the right therapy for you. Now, you do that by participating in something like GlucoseZone. You do that by making the common sense changes to your diet. If you have diabetes, if you are at risk for diabetes, the bottom line is your body has trouble processing carbohydrate. Bottom line. So a common sense thing is stop eating so many carbs. It's like really that simple. Okay? If you have diabetes, the bottom line is you potentially can have trouble processing protein. So what's a simple solution to that? Stop eating so much protein. And generally speaking, especially here in America, we overconsume protein, we overconsume carbohydrate, and we actually, in many cases, underconsume fat, the macronutrient fat. Why that happens, that's a whole nother diabetes talk, okay? The last thing, guys, I want to talk about, very, very important, is the other side effects associated with diabetes medications that are not hypoglycemia, not low blood sugar. And some of these can be really, really serious, and you need to be aware of them if you're taking these medications. So, for example, if you are taking SGLT2s, which is Invokana and Farxiga, there are known side effects such as urinary tract infections, hypotension, that's low blood pressure, increased urination, genital infections, and ketoacidosis, okay? If you are taking GLPs, pancreatitis, so GLPs are things like Victoza, Bidurion, Trulicity, those types of drugs. There are known side effects of pancreatitis, nausea, vomiting, abdominal pain, unwanted weight loss, okay? If you are taking sulfonylureas, there are known side effects like nausea, bloating, diarrhea, B12 deficiency, okay? Weight gain. Weight gain is the #1 side effect of taking insulin and sulfonylurea, all right? And if you're taking a DPP-4, there are known side effects like headaches, flu-like symptoms, and joint pain, all right? Now, ultimately, guys, I want to encourage you, understand the point of this talk, help you understand the whole picture of diabetes medication, encourage you to investigate, okay? Encourage you to investigate what are the medications you've been prescribed, why you've been prescribed those medications, and are those medications actually addressing your cause of hyperglycemia, okay? And the bottom line is, every single medication for diabetes, when you see a commercial for those medications, it starts with the following phrase: along with diet and exercise, this medication will help you manage your diabetes. And that's a real statement, guys, because the bottom line is, there is no substitute for consistent, healthy, and smart exercise. And you know what the side effects of healthy, consistent, smart exercise are? Better sleep, weight loss, increased muscularity, increased aerobic performance, increased sex life, increased alertness, okay? Those are the side effects that you will experience when you increase your exercise. And on that note, guys, we're going to call it a night. I want to thank YouTube. I want to thank Instagram. I see you guys. It's great to have you here. I want to thank everyone who joined us in the GlucoseZone app and everybody who joined us on Facebook. You guys are awesome, and I can't wait to see you in the GlucoseZone.